Elite Nutrition and Performance. Today, Kristen and I are going to go through a couple of exercises to help you with some low back pain that you might be developing during your pregnancy.
Hey, I'm Kristen, certified personal trainer and registered dietitian here at Elite Nutrition and Performance. I'm about 19 weeks pregnant and I have struggled with some lower back pain in my SI joint, and I can tell you that it's highly uncomfortable, but Jessa's going to walk us through a bunch of exercises to help alleviate that and strengthen your lower back so that you don't have lower back issues for the remainder of your pregnancy.
Today we're going to start off with Kristen on a mat, and we're going to go through an exercise called Bird Dog. So she's going to go on her hands and knees, making sure that her shoulders are on top of her hands and that her chest is up into her back, so she has a nice flat back, and her hips and knees are on top of each other. She's going to start off by reaching with her opposite arm, opposite leg, trying to keep her pelvis down, back straight and tight. She's going to pause for a second and then come back down, and then she's going to do the other arm and leg reaching out, keeping her tummy tight, also coming back down. Also, you can see she's keeping her head in a neutral position, and she's going to slowly and with control go through this movement. She can start off with about 10 on each side, doing about 3 sets of 10. Good. All right, the next exercise Kristen's going to demonstrate for us is called a clam. So she's going to lay on her side, her knees are going to be bent, and the first movement, she's going to lift her knee, but she's going to keep her feet touching. Good, and then she's going to nice and slowly lower. Good, and raising up and lowering. This is a good exercise to help strengthen the hip and butt area to help support your low back. So you can start off with no band, and then if you feel like you need some extra resistance, we can add some resistance by putting a TheraBand around her knees. Still in the same position, feet are going to stay touching and still doing that slow controlled movement, lifting the leg and lowering it, activating that hip and glute. Very good. All right, the next exercise we're going to demonstrate today is a side plank with a leg lift. So we're going to do a modified version first. So what you're going to want to do is bend the bottom leg and straighten the top leg. Okay? So when she bridges up into her side plank, she's going to be using her knee, and her elbow is going to be underneath her shoulder. And then once she gets up into that side plank position, she's going to lift her leg. Good. And you can start off by doing 10, 15-second holds. Good. Keeping her tummy tight, strengthening her hip, strengthening her core, all at the same time. Good. All right, so to make it a little bit harder, we can straighten that bottom leg, putting her feet up on top of each other. She's going to bridge up again, but now lifting the leg up. Good. Holding it for about 10-15 seconds to start with, and then you can gradually increase your time from there. Good. And rest. All right, the next exercise Kristen's going to show for us is a base stance rotation while sitting on a stability ball. So she's going to start by having a nice solid base. Her tummy is tight, her knees and toes are forward. She's going to have both hands on the resistance band. Her shoulders are rotated as much as she can towards her band, and then she's going to pull her hands across her chest while keeping that tummy tight and nice tall back, and nice and slow on the release. You don't want that band to pull you back. So make sure that your tummy's tight, you have good posture, and you're controlling the band at all times. You can start off with 10. Very good. And then she would turn around and you'd have to work the other side as well. Alright, so we went through a couple of exercises. Some things that you can do after these exercises or even after your regular exercise routine are a couple of mobility and stretching exercises. So the first one that Kristen's going to show us is called cat camel. She's going to be back into that quadruped position, shoulders and hands on top of each other, hips and knees on top of each other. She's going to tuck her chin and push her chest up into her back and arch her back. And then she's going to lift her head and sink her back in. Good. Inhaling when she goes up, exhaling when she goes down. Once again, this is a controlled movement, trying to just get some more movement through that spine. 3 sets of 10 of these are good to start with. And then the last exercise that she's going to show us is child's pose. So she's going to push her butt back, reach those arms out, and sink down into her stretch. Now, as your pregnancy goes along, your belly might start getting in weight, you can widen your knees to create more room for your belly to hang. Holding these for about 15 seconds, coming up out of it, and then going back down into your pose.
All right, thank you for watching. So these exercises and stretches you really want to do a couple times per week. I would say 3 to 4 times per week to really strengthen that back, and just do them as you feel comfortable. As your back starts to feel better, you can do a little bit more and you can make them a little bit harder. So make sure that you're listening to your body as you're going through all these exercises and stretches, and don't try to push your body beyond what is really comfortable. However, like I said, you want to do them a couple times per week to really strengthen your lower back. Thanks again for watching, and we will be with you next week with another video on nutrition during your pregnancy. Thanks.